Thank you for listening to me today, and I'm sorry I couldn't be there in person. I want to talk to you about a patient and public involvement consultation that I completed during the development of a patient information leaflet for Cauda Equina syndrome. Cauda Equina syndrome is a rare spinal emergency. For patients suspected of having this condition, national guidelines mandated emergency MRI scan to expedite the diagnosis. This leaflet was part of a larger quality improvement project at Somerset Foundation Trust. The aim of the project was to redesign the referral pathway from community referral into the hospital for emergency investigations. The pathway steering group anecdotally found patients did not understand why they'd been referred into the emergency department, and therefore their expectations were rarely met. Patient information leaflets have been shown to improve patient understanding and engagement within healthcare. For this reason, we wanted to ensure that a patient information leaflet was part of our overall pathway. In the latter part of 2020, we designed a patient information leaflet explaining the steps that they were just about to encounter. I wanted to make this patient information leaflet really patient-centered and very usable. And therefore, I wanted to do interviews with patients during that development to help guide the overall document. To help me do this, I completed a qualitative research module at Plymouth University to help guide the development of those interviews. As stated, the PPI was part of a bigger quality improvement project, and therefore ethical approval was not sought. 5 former patients were engaged as expert advisors. All of these patients were contacted in their usual care and had been through the old CES pathway. Semi-structured interviews were completed on Zoom. They were recorded and transcribed verbatim using NVivo 12 software. Thematic analysis was used to identify any common themes throughout these interviews. And then the codes and the themes were triangulated through peer and advisor review. 33 codes, 13 sub-themes and 5 themes were identified. Overall readability, knowledge and guidance, and reaction were all felt to be part of an overarching theme of communication. As I said, readability and language are really important for this document, and therefore I utilized a simple measure of gobbledygook tool. This is a tool that's been validated within healthcare as an effective way of pitching the readability of a patient information leaflet. And all of the advisors felt that the information was easy to take out of the document within the first read. One of the things that they've really helped us with was the layout. This is really important for engagement within the document. The advisors felt that we needed to break up the text and move around some images. Overall, I think this improved our document no end. The advisors felt that knowledge promoted positive emotions, and awareness of the outcomes helped with that discharge planning and understanding why the understanding of the pathway. One of the key things that all advisors identified was the digital divide, with the need for a digital and physical version of the form, specifically moving into a virtual world. The advisors confirmed that they had a disconnect with their pathway, but they felt that this leaflet would help with that. So overall, one of the major limitations was time. As I said, this was a qualitative research module, and therefore it was a 6-week time frame to complete. This led to a reduced number of advisors and question around saturation of data. An evaluation has not been completed yet, as this is part of a larger project that's only just gone live a couple of months ago. In conclusion, I think patient and public involvement in the development phase of this project helped increase the quality and the usability of that document. It also helped identify and overcome issues such as the digital divide. What I would do differently next time is involve those advisors sooner. Use them to define the problem, help to develop the content of the leaflet more effectively, and also plan some more evaluation. As you can see, the QR code at the bottom of this sheet is the digital version of our final document, which I'll be happy if you could please look at. Thank you for listening to me today, and I'm happy to take any questions via email.